This is a female patient in her 60s. In older patients, the fat often appears spread out. This is because the skin has also sagged over time. She has asymmetry and, of course, visible dark circles. They are visible in the front, and on the left they appear longer. Naturally, she also has tear troughs. A unique feature of this patient is her lack of eye elasticity. Her lower eyelids are slightly pulled away from the eye. This indicates dryness and a significant loss of elasticity. The most important steps are releasing the tear trough and moving the fat through that released area to fix it into the hollowed out sections below. I used a precise 5-point fixation technique. Due to the asymmetry, I performed fat grafting in the hollow areas and used conslet fat grafting to alleviate the dark circles. For the procedure, I made an incision about 2 to 3 millimeters below the lashes. Because her skin lacks elasticity, there was a risk of ectropion, where the eyelid turns outward after the skin is pulled. To prevent this, I performed the Pentagon procedure alongside the surgery. If you look closely at these photos, you can see the scars. There are still some scabs on the day the stitches were removed. The area under the eyes looks a bit bulging and swollen. Again, the Pentagon procedure was done to ensure the lids stay in place. Looking at the photo from 3 months later, the results are excellent. In the before photo, you can see how the fat was spread out due to age. The tear troughs were clearly visible across the entire area, and the dark circles were quite extensive. The core of the treatment was removing the trough and repositioning the fat. I even repositioned the fat toward the outer edges. The fat must pass completely through the tear trough area. The Pentagon procedure was successfully integrated here as well. In the post-op photos, you can see the incision marks. This was taken immediately after the stitch removal. The marks from the Pentagon procedure are also visible. Right after removing the stitches, the tear trough might still seem visible. This is because the skin is swollen, which can create the illusion that bulging fat still remains. However, after 3 months, the scars have significantly improved. The Pentagon scars are barely visible to the naked eye, and the tear troughs have improved remarkably.